Hi, welcome to my channel Nursing Mary C. This is Miss Sharanya Sajid. Today I'm going to deal with the overview of all the station or the most of the station in aptitude exam. It's a part 1 video. Here I'm going to discuss all the stations very briefly to give an idea about the stations which you can expect for the exams. Here we start. So first is a scenario of 72 years old man with chest pain. This scenario I have already discussed in detail in my previous video. This is a brief discussion because this is for the people who has exam coming soon, so they will get an idea about all the station. I don't want to explain about this station because I have mentioned about this station in detail in my previous video, so you have to go back to the video and you can see what is this station. So there they are going to give a situation of 72-year-old man with the chest pain. So there what you have to do is you have to do all the assessment of person with the chest pain and you have to administer the GTN. It's a medication for the chest pain. Then second scenario, it is also related to the chest infection. Here it's a technical skill 65-year-old woman with chest infection. So here they are going to check your technical skill. So technical skill means some procedure you have to do. So what procedure you have to learn here is for the chest infection patient, they will give, this patient has chest infection, just give the nebulization. So you should know about how to give a nebulizer or how to administer the nebulizer. That's what you have to learn in this station. So there they are going to check your technical skill, so how you are practically administering the nebulizer. The next scenario is scenario of 75-year-old man with constipation. So here what you have to learn is you should learn about how to assess a person, how to holistically assess a person with a constipation. So you know, if a person has a constipation, you have to palpate their abdomen to see if it is distended, or you have to ask about patient about their food intake, water intake, all those assessment you know. So these all are the things you should learn and you should do there in the station. The next one is a patient education. So here we have to educate the patient who has a constipation. The next scenario is scenario of 52-year-old man with COPD or the chronic obstructive pulmonary disease and upper respiratory tract infection and breathlessness. So in this scenario, what they are going to give you is you have to do the vital signs. You have to check the vital signs of the person because that patient has the respiratory tract infection, and you have to do repositioning because if they have breathlessness, of course we have to reposition. We should give the fallows position or semi sitting position for the patient and the oxygen therapy. So you should read about these all things. If you are learning these things, you can easily do that station. The next station is scenario of 63-year-old woman, or sorry, old man with diabetic mellitus. So as you all know, if someone has diabetic mellitus, of course they will be in the insulin therapy or the medication for the reducing the glucose level. So you should learn about hypoglycemia, and in this station you should know how to recognize a patient with a hypoglycemia and how to treat. So all the symptoms of hypoglycemia, maybe they will tell you like this person has diabetic mellitus diagnosed with this one, now he has so and so symptoms, maybe those are the symptoms of hypoglycemia. So you should tell, yeah, this is the symptoms of hypoglycemia you diagnosed, and you are going to treat like this. Thank you for watching. So that's all about the part 1. So I'm going to continue this one in my next video. So if you like this video, you can give a comment, and if you're okay with this, I can give this one full stations like this, so that everyone who is getting the exam soon, they will get an idea about all the station. Thank you. Have a nice day. See you soon.